Okay, it's ready now.
So we know that rehabilitation following ACL reconstruction is physically demanding, but it can also be emotionally challenging. And there can be a number of emotional and psychological challenges along the process. And these may differ depending upon what stage that you're at. What we might commonly see is that during the early stage of your rehab, you can be fearful of moving your knee. This is what we would term as kinesiophobia. Okay? This can be for a number of reasons. So you may fear that you are going to injure the graft that you've just had surgery on, but often it's in relation to pain of your knee, and moving your knee can sometimes increase the pain that you experience. It's important to realise that discomfort and pain at this stage is completely normal. If it is a significant factor, you may wish to discuss with your physiotherapist various pain management strategies to then enable you to get your knee moving. What we're looking to avoid at this stage is your knee becoming particularly stiff because of that fear of movement of your knee. During the middle stages of the class, people will often report a lack of motivation, perhaps some frustration, and sometimes a level of boredom. Okay? If you are having these feelings, then definitely discuss it with your physiotherapist, and they can look at your rehab program, perhaps change some of the exercises that you're doing, perhaps make them even more specific for you as an individual. In the latter stages of the rehab process, when you're thinking about return to sport, fear of re-injury can be a significant factor. And this is often a fear of re-injury when you're returning to the same activity or situation in which the original injury occurred. People will often feel that their knee does not feel the same as it once did. And again, this is completely normal. And this feeling can be despite you having achieved various physical milestones, such as adequate strength, good ability to run and hop and jump. And at this point, your physiotherapist can be quite happy in terms of the physical achievements you have made, and yet you still don't have the confidence in that knee. We know from the medical research that these psychological factors can be key in achieving your goal of returning to sport. It can affect whether you return to sport at all, or it can affect the type of sport that you return to, or perhaps the level of competitiveness of that activity. So what can we do to help? So we've mentioned already, discussing with your physiotherapist, they will certainly have some helpful ideas for you to introduce. They may ask you to focus perhaps on some of the perhaps negative or unhelpful thoughts that you might be having. It's important to realise that these thoughts can sometimes influence your emotions. It can also influence various kind of physical factors, and it can certainly influence your behaviour and sometimes your movement patterns. So tackling these unhelpful thoughts, we want to change them into more positive thoughts that will aid your recovery. And finally, sometimes people just require a little bit more time at the stage that they're at. This is sometimes to consolidate the gains and improvements that you've already made, and to gain confidence in your knee at that stage.